this. So Scott and Chris and I talked a lot about we don't want to just do something to say we did something, right? We want to see if it actually worked. So as gung-ho as everyone is, we want to say like, hey, let's build some structure around this and some research design to see if we can tease out any statistical changes over time. So in general, our project is a study that will measure the effect of mindfulness-based training on behavioral markers in participants, including levels of burnout, resiliency, alcohol use, depression, anxiety, and stress, as well as participant opinion on the training provided. So I think the outcomes are pretty important to talk about, because when you look at a training program, you can't use, say, suicide rate as an outcome in 6 months, right? Because that doesn't happen at an individual, fire district, hopefully every, few months. So we really went and looked at kind of markers for high-risk suicide, and those are the ones we came up with. So this will take place over 5 months. So participants will be asked to complete a baseline survey, post-training survey, and a 3-month follow-up survey. And our hypothesis is that among firefighters, mindfulness-based training program will significantly improve mental health measures between baseline and post-survey, as well as retain long-term changes. So our survey consists of a lot of sub-surveys, but to the participant, it'll look like about 90 questions that can be completed in 20 to 25 minutes. It's going to cover several unique areas and allow us to analyze these different markers and see if there's any changes over time. So it includes general demographics, general information such as marriage, race, sex, age, work history, some work experience, including a number of suicide calls and attempted suicide calls, which prior research has found to be a big marker for increase in suicidal ideation and depression. Use a burnout inventory, resiliency, depression, anxiety, stress scale, mindfulness, attention awareness scale, the alcohol use disorder identification test, as well as post-intervention acceptability questions. So what's great about us taking the time to develop this survey this way is each of these sub-surveys have been tested and validated in prior research. And then at the very end, our post-intervention acceptability questions really get at what we were discussing about, is this palatable to the culture of the fire district? So some of the questions are, is this relevant to my career as a firefighter? Would I recommend this to someone else? Did I think it was worthwhile? Questions like that using a 5-point Likert scale. So our only exclusion criteria is you have to be working age 18 to 65. Sorry if there's any really old firefighters out there, but you can't participate. Have to be a current firefighter, and we want to see any changes from our interventions. So if you've participated in a formal mindfulness-based training program in the past 6 months, we're excluding you from that. So this is our timeline. So it's great to see it all come together. Starting tomorrow is the initial onboarding with informed consent and pre-intervention surveys. So that'll be taking place this week with our start date for the class on the 22nd. And then in June, we should be completing that 8-week program and do initial post-intervention surveys right after the last class ends. And then we're also going to do a 3-month follow-up survey in September to see if there were changes, did they stay? And so this is really the snapshot of what questions we're hoping to answer. So what is the current state of Golden Ranch Fire District? And we'll use the analysis of pre-training survey to see where they're at right now. Effectiveness, did it help? And we'll use comparison of pre and post-training survey questions. Permanence, did participants maintain any positive change that we found? And so that's what we'll utilize our 3-month follow-up for. And then acceptability, what is the opinion of mindfulness-based training? So there'll be questions focused on the opinion of the firefighters. All right, thank you for your time. Are there any questions you have for any of us?
Yes.
So for the suicide attempts, is that all based on the polls then, or is there any hospital backing with that as well? Like when we take patients, for instance, in for suicidal ideations?
I didn't.
I was going to just kneel over to you.
On the suicide attempts, is that just polls, or is that like when we take patients into for the hospitals?
So the suicide attempts specifically to firefighters are based on two surveys, anonymous surveys. And so anonymous surveys are great and really let people answer truthfully, but sometimes they can be skewed, which is why it's important to follow up with a structured research project.
One of the things too in creating the survey is we wanted to make sure everybody knew up front that this survey and all the data and everything specific is for the university. It's not for us. So please be honest with like your alcohol use right now, because it's not going to go right to Chris and I, and then we're going to red flag and say, oh, this dude's going to rehab before he even gets started. We need it to be completely anonymous so that we want people to be honest in it. We want people to be honest with us. Where's your baseline right now? So that we can truly gauge where's your baseline after it.
Yeah, so I think it's really important, and we talked about it a lot, is that there is no sharing. This is an IRB approved by the University of Arizona with protection in place for participants to ensure that their data is not shared with Golder Ranch. And the information that will be shared with Golder Ranch and potentially the world will be aggregate de-identified data showing change over time. I told you guys this story when I was down in Tucson that in flight school, I showed up at flight school, and before we had started training, they brought us all in this room, and there was this nurse there, and she's like, you know, it was a pitch for a research project they were doing, and it was on motion sickness, and they wanted people that had never flown before and people that had flown. They were going to stick us in the back of the helicopter, blindfold us, fly around for a while, and see if you got motion sick, see if there's a difference, right? And they were pitching that to us, and me as a not having experienced research before had a lot of disbelief in the fact that the Army would not keep track of what I said, because motion sickness is a disqualifier, initial disqualifier for flight school. So they're asking us to answer a question on the survey that would disqualify me from flying before I even started. You know, knowing now what I know, there's no way the Army would get that information, right? They were just, you know, looking at improving trainee selection. But I share that story because it's really important to, you know, that we share when we present the research option, like the opportunity to take part in the research to the firefighters, that it's not going to be shared with them. And really it's not just for the betterment of them, but the data's for the betterment of firefighters all over.
Right, and even some of the sales points and getting people involved is, okay, we totally agree that your life is dialed in, but if you get this training, you might be able to help somebody else, right? Right. It won't be for you, it'll just be for a way to help somebody else. So bear with us and be a better peer if you don't think you need the training for yourself. And people are able to get on board with that, so fine.
Any other questions for us? Thank you.
Thank you.